I think that the primary care physicians are under so much pressure to do so many things during their short visits, and they have so many patients to see. So I think the main thing I would, a lot of patients, always are interested in are there any other options? Maybe they don't want a surgery, but maybe they're not satisfied with their medicines. We talked about the 20 to 30%, and they want to have a conversation. And the main thing for them is to be aware that there are options, including endoscopic options, to do this. And I'm more than happy to have that conversation with them. I think the key thing that people do need to realize is, and this may be part of that 20 to 30% not responding, is that some patients who we think have reflux probably don't have reflux, and they have some other condition. It's important to exclude that. Some people have something called functional heartburn, which is more of a sensory issue and actually is managed very differently. And those patients may not benefit from a mechanical barrier, reconstruction or augmentation. So I think it's important to know what you're dealing with. If someone's not responding to medications, you sort of wonder. That's why we do the pH testing. We sort of do we can measure the amount of acid. And that's actually another endoscopic test that we do in addition to inspection. We often can do a pH test where we place a small probe in the esophagus, and that can stay in for up to 4 days, and we can see how you respond both without medications, how much reflux is there, and then also we can see how much acid exposure is reduced when you start anti-acid medications to assess response to therapy. And this is useful to figure out if someone is not responding. Is that because you don't really have reflux, or you do have reflux but the medicines aren't sufficient, and that you're still having abnormal acid even after taking the medicine. So these are some useful things that we can investigate. But I think the main thing for the primary physicians to know about is that there are these options, that we do have sophisticated testing to tease out whether people have reflux or not. And I'm more than, at least me personally, and I think most of my colleagues, we're happy to help them make that assessment.